Assalamu alaikum wa rahmatullahi wa barakatuhu. Esteemed viewer at MTA Africa, you're most welcome once again. It's your program Health Check, a program where we bring medical experts to share views that can benefit you in as far as living a healthy life is concerned. And in today's program, we're going to discuss about hypertension. And what is hypertension? As far as I know, simply that is high blood pressure. And the list I managed to conquer or to capture regarding hypertension is that it is a serious medical condition and can increase the risk of heart, brain, and kidney attacks. It is the major cause of premature deaths worldwide. That's the list I could manage to get for you. And since I'm not a medical personnel, I managed to find someone in the names of Dr. Asimwe Bravo to come and help us understand what really is hypertension. And Doctor, you're most welcome.
It's a pleasure, sir.
With me is Dr. Asimwe Bravo in the studio, but it has been a norm that it's better we have more than one to see how far we can go in as far as understanding the topic of discussion is concerned. And I managed to reach out to our brother who has been working with us in the previous episodes, but unfortunately has not managed to be with us in the studio, and that is Dr. Ivan Muchunguzi. He's online and he will be following us. Whenever we have a question, he will be coming in to explain and yes, Dr. Asimwe Bravo is with us. Doctor, you have heard me defining and trying to explain, as far as I know, what hypertension is. But you're a medical personnel. You know much better in that field. Many people outside there might be knowing even less as compared to what I know. So I would like you to give more light on what a hypertension is, such that our layman outside there understands what really this disease is.
Well, thank you very much for the questions. First of all, I would say hello to the viewers.
Yes, thank you.
And I'm privileged to be here. Coming to your question, talking about hypertension. For us now on the medical side, on the medical field, or medics, how we look at it, we say hypertension. It is a medical condition we are looking at increased blood pressure. But when we say increased blood pressure, we don't only stop there. At times we include in measurements.
Okay.
That is if majorly we look at an increased blood pressure of more than 130, that is systolic, millimeters of mercury over 80. What we call also millimeters of mercury, that is diastolic. But that measurement, it is if done to a patient who has come in, maybe it is done twice, or what we call office visits, or you've come to consult, but we give it something like 6 hours when the patient is resting. Or we can do it 2 or 3 times within a week. Like every weekly he comes in, then we check. And then that's when we say someone is having hypertension, or what we are calling increased blood pressure, not just as a single measurement.
Okay, coming like testing for malaria.
Yeah, now for this case, we are doing a checkup.
Okay.
So we put our machines, the blood pressure machine, we measure. But we don't take only one single measurement. We wait 6 hours later when the patient is resting, not doing anything.
Okay.
Yeah.
Then you check again.
Yes, then we check again.
Okay. Thanks a lot, Dr. Asimwe. Our beloved viewer, like I promised you early in the program, that we'll be joined in who is online, our brother again, and a doctor, that is Ivan Muchunguzi. In case we had any question, we would call him in and he will convey his explanation to us, and this is the very time we've been waiting for. Dr. Ivan Muchunguzi, Dr. Asimwe has explained what hypertension is in as far as the medical point of view is concerned. And to this point, I'm calling you in to explain to us what the causes of this disease are. Dr. Ivan, to you now.
Thank you so much once again, the moderator of today. Regarding the risk factors of hypertension, like I've all seen, most of the risk factors regarding hypertension, they arise from a sedentary lifestyle. When you talk about a sedentary lifestyle, we mean living a life of not doing exercises. So once you don't do exercises, you're at a risk of getting hypertension. This is because once you do exercises and more regularly, you're helping the body to cut down fats in the body, which help to reduce the cholesterol levels, which would eventually clog the blood vessels and your blood pressure goes high. Then another risk factor, of course, apart from the exercises, is obesity. Once you're overweight, you're at a high risk of getting hypertension. This is because once you're overweight, in most cases, the blood vessels which take blood to the different parts of the body are always clogged with fats, the cholesterol, and they make the blood vessels to become narrow. And once the blood vessels become narrow because of taking too much fats, because of being overweight, blood pressure, as blood is passing through the vessels going to the lower extremities, it's pumped with high blood pressure, thus you end up getting hypertension. Then another risk factor of getting hypertension, it is age. Most cases, the elderly, those who are 40 years, 45 years and above, are also at a high risk of getting hypertension. This is because as you grow old, the vessels become hard and they lose their smooth texture, and then they make the blood vessels to become narrow. And as blood passes through also, it goes at high blood pressure, and eventually you end up getting hypertension. Then another risk factor of hypertension is race. Hypertension is, we have some forms of race where hypertension is common, and this hypertension is common in the African race, though it is also common in the white race, but of recent it has also gone and risen in the African race. Then another risk factor of hypertension is heredity. Once you have someone in your family or in your first degree relatives who wants or has hypertension, there is a higher likelihood that in the grandchildren or in the children, there will also be someone who will end up developing hypertension. And in most cases, this is the hypertension of unknown cause, which is not secondary. Like I told you before, we have primary hypertension and secondary hypertension. The secondary, it has known causes. Once the known causes are treated, you do away with it. But in most cases, what you call primary hypertension, this one which is idiopathic, you don't know the cause. And most of the risk factors for that are those ones I've talked about. Thank you so much for giving me this opportunity. Thank you.
Dr. Asimo, you've heard him. Do you have any addition on what he has just explained to us?
Well, I've heard, but I can supplement or add on something small.
Okay.
There is also what we call hyperlipidemia.
Hyperlipidemia.
Yeah, we are meaning you are having a lot of fats within your body, and at the end of the day, when they come up or collect somewhere, maybe where blood is passing, these are vessels.
Okay.
If it collects somewhere, it makes like a plug. That means blood cannot pass.
Cannot flow smoothly.
Yes. So at the end of the day, we get cases of hypertension from there. We also have other conditions like diabetes. You find hypertension is also what? It is coming in as a complication. Okay. So we are getting hypertension still aside. So there are many risk factors to this.
Okay.
Yeah.
So, doctor, now this brings me to the next question, which what and how can I know, or how can one know that they have hypertension? By this I mean the signs and symptoms of hypertension.
Yeah. Now, when we come back, for one to understand that you're having hypertension, or thinking maybe I am having something related to this, what we always do, or we think, or a person can see and then tell, this is what I'm having. Most times we have headaches. Yeah, I mean, these are headaches, they are on and off. At times it is on and increasing in severity. So most times we take one as a symptom of hypertension. Then we also have some people feel tired very easily, or let's say they are sleeping down on the ground, sleeping flat, but they cannot breathe very well.
Okay.
When they are sleeping, it means they need to sit up. It's like someone is gasping for air. Or it is in the middle of the night, someone is sleeping, they have to wake up and to get some fresh air, open up the window and then get some fresh air. But again, times you see hypertension is two-way. We have primary, or what we call essential hypertension. That is where we do not having any, or we don't identify really the causes, but we can easily tell what brought it. Then there is the other one that we call secondary. Now secondary, it is you are having a problem or an illness. We can say, let's say, kidney failure or diabetes, like I said at first. So we are going to see someone has been having diabetes, but there are continuous other side symptoms that are coming up, or they are persistent, but more so relating to the heart. Yeah, so at the end of the day, we come up with some of signs and symptoms, but this patient that comes, they're already talking about headaches, lightheadedness, I get tired so easily, some things of the sort.
Okay.
Yeah.
Thanks a lot, Dr. Asimwe, for such a wonderful submission. And this now takes me to preventive measures. You know, we Africans, most of the times, spending on our lives is a burden. Yeah. I'm sorry to say, but that's the fact. Spending on our lives is a burden. So one would rather die than spending money on their lives. So I wonder if there are some other shortcuts that we can save the lives of these people before they die of hypertension. I mean, what are the preventive measures? How can one prevent him or herself from getting hypertension?
Thank you very much. Before I come to that, maybe there is something that is common that I didn't mention in the what it term as symptoms. We have palpitations. You hear the heart is beat. Some say it is too much, beating so much, and dizziness.
So beating rapidly.
Yes, that is what they are saying. Then coming back to what you call preventive measures. What do I need to do so that I don't get this?
To avoid this.
Well, we have some things that you can do and avoid, but there are others that you may not easily do. Number one, we've seen in the risk factors, we have what we call sedentary lifestyle. This is, you eat your calories, foods that are having a lot of carbohydrates. You only eat, sit. You're not using the body. Exercise is part of what we need to exercise.
Okay. So
at the end of the day, it makes us fit, one, and again, it's good for our heart and the whole body. Number two, we see obesity as a risk factor. When we're talking about obesity, these people who have passed, we call body mass index, it is past 35, 30 and above. So it is about, we don't need to accumulate all that weight. Look on ways on how we can reduce on the weight. Then another thing is, we are having almost every step we make now in the towns, in the centers. There is a clinic, there is a medical center, there is a hospital, a health facility nearby. It is important for us to always check, periodic checks up. We need to check, and then you get to understand
How you stand.
Yes, how do I stand? So there are some other things, maybe like the one that is running in the family, still doing just a lifestyle matters most. And again, balanced diet. Because we are seeing a lot of fats, talked about hyperlipidemia, we are having a lot of fats or lipids within our blood. How do they come in? We are only eating, not using the body. Again, we are taking a lot of fatty foods. Those are the things that can bring. We also have other foods like junk foods. Even people who use nasal discongent, the one that we use, we're having flu, you go to a pharmacy, give you some medication. Those that are having caffeine and maybe most cases, they lead us, so it is like a risk factor too. So we need to stop that, and alcohol. Some people take alcohol.
So let's go back a little bit. So one must avoid all kinds of medicine that have caffeine within them?
Not necessarily. What we are saying is avoid the self-medication. I've gotten this, so you rush to there.
I understand.
When you come to a doctor or you meet any medical personnel, of course, we make a judgment before we give any medication. Then there are also people who smoke. Smoking, take any drug abuse. Smoking, I've talked about alcohol. We've talked about caffeine. Even these other drugs they do, they have caffeine. So at the end of the day, we're just exposing ourselves to this. Yeah.
Okay. Thanks a lot, Dr. Asimwe. Thanks so much. Indeed, our beloved viewer, you have learned a lot. You have learned what to avoid. It is very expensive buying junk foods, in as far as I know, and it's very cheap to avoid them. So you'd rather avoid them than investing yourself into the hypertension, a killer disease, just like we have seen in the previous explanations from the two doctors. So avoid the junk foods, use the body in doing exercises, and take the advice from our doctors that we bring here for your own benefit. And that is the very purpose of this program. This now takes me to Dr. Ivan Muchunguzi. Each and every disease with its own complications, and we would like to know today what are the complications, that come about as a cause or as a result of hypertension. Dr. Ivan.
Okay, thank you so much, moderator, once again, for giving me this chance to give my final remarks concerning hypertension. Well, regarding the complications of hypertension, the complications of hypertension, there are about 5 to 6 complications which come as long as the blood pressures are not regulated. Once someone gets hypertension, that is high blood pressure, which is above 140/90 millimeters of mercury, and someone is not initiated on treatment, he is likely to get some complications which include the following. First of all, someone whose blood pressures are not controlled is at high risk of getting strokes or heart attack. This comes about when blood pressure is being pumped in narrow blood vessels, especially the blood vessels going to the brain. So in any way, one of the blood vessels which is supplying the brain can rupture because of high blood pressure, and someone will end up getting a stroke. Then another complication is that someone who is having high blood pressure is at a high risk of getting heart failure, because the fact that the heart is trying so hard to pump blood with much resistance, it will put too much pressure on the heart, and the heart will be forced to put in too much power to pump blood to reach the peripheral tissues, and in so doing, the heart will be overpowered and one may end up getting heart failure. Among the vital organs which need blood, like I told you before, we have the brain, but we also have the kidney. So once these blood vessels are narrow and there is too much resistance which the heart is meeting to pump blood to the kidney, which is one of the vital organs of the body, we're going to end up having complications and kidney failure. because the kidney, which is one of the vital organs, may not be able to receive enough blood. And once it fails and it is no longer working, you may end up having what we call multiple organ failure. Also, high blood pressure also has bad effects on the eyes. Once there is too much pressure or resistance met by vessels supplying the eye, you can end up having what you call a retinopathy, and someone may end up losing his or her vision. The last bit of it, hypertension can also cause some peripheral neuropathies, and this comes when the blood which is going to the peripheral parts of the body, including the hands and the feet, is not controlled, and somehow, somewhere, the fact that the blood is meeting out of resistance, some parts of the body might not receive the blood, and they may end up becoming avascular, and someone may end up having neuropathies, feeling funny sensations in the peripherals, including the feet and the hands. And if unlucky, someone could also get what you call avascular necrosis. This is when a part of the body dies off because of lack of blood supply, and if you're unlucky, still you may end up being amputated. You may end up losing your limb, or you losing your hand because of avascular necrosis, because of high blood pressures which were not controlled. Thank you so much. Those are some of the complications of hypertension if it is not controlled with medications. I remain Dr. Ivan Mchungzi. To the viewers, thank you so much. We hope you benefit from this.
Thank you so much, Dr. Ivan. The viewer, you've heard yourself. You've heard for yourself. He hopes, and we hope, the health check team, that you benefit from the advice that these medical people share with us. Doctor, you've heard him. Among the complications, he talked of the heart attacks. It brings about the strokes and eye problems, kidney problems, and what have you. Do you have any addition to his explanations?
See, hypertension is a broad thing, broad medical condition leading the heart. As we've seen, I can add on, but majorly
just
going...
like our viewers having a look at the screen.
Yeah, I can add on as maybe go by an organ. Okay. An organ, I mean, for example, the heart.
Okay.
As for the heart, we are having an issue that comes up. Within the heart, mostly, there's what we call myocardial infarctions, because or what we call coronary artery disease. Coronary arteries, these are blood vessels that supply to the heart itself. It is having blood vessels that bring blood to its tissues to do its function. So if there is now hypertension that is uncontrolled, at the end of the day, we might make them overwork, or still, because of other causes, there could be an issue with them, and we end up a person now having a problem with the heart, leading to what we call myocardial infarction. It's like death of some of the tissues of the heart. And again, we have talked about stroke. At times for us, when we are there talking, can say it is what we call cerebrovascular accident. You hear cerebral meaning the brain,
yes.
Vascular, the blood vessels supplying to the brain. Then accident. Something has happened. Because stroke is two, it can be ischemic, where you are having reduced blood that is coming in with oxygen. We are looking at oxygen coming to its tissues. Or hemorrhagic. Could be any, maybe it bursts up and it starts, blood can start to puise off. Then another thing that we can say complication, we look at secondary hypertension, because it is secondary to most of the underlying conditions. If we are having renal failure we are looking at the kidneys. If there is less perfusion, so what will come up at the end of the day? If there is less perfusion, it means all what we see in kidney failure, this person is going to end up with them.
Sure.
Yeah. So There are as many, but it is a condition leading to a condition. So even when we are talking or discussing with the patient about this, we understand the patient's condition after different tests and the rest, then we handle you accordingly with which condition are you having. But there are as many as you can mention them.
Okay.
Yeah.
Thanks a lot, Dr. Asimwe. In the previous episodes, I've been telling my colleagues, your colleagues as well, the doctors, that we have failed to create a bond that is positive or that is good between us and time. Yeah. Time has never been a good ally with us. He is calling us off, so I'm going to request you to give us your concluding remarks before I agree with what time wants.
Coming to my final remarks, I want to thank you for giving me the opportunity to be here and talk to the viewers. And again, to the viewers, it is always us, it is me, it is you to see how your life goes on. We always say come for checkups, there is no one who is going to pull you out of your comfort zone to bring you to a healthy first, but it is more important for you to understand this. And then I wish them all the best. Likewise, us here as we are doing.
Thank you so much. We wish you all the best. I can't go beyond this. I remain your host, Nambali Bashir, and until we meet in the next episodes, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.